for that. And action. Hello everyone, welcome to another episode at Doctors of Podiatry. We always have interesting cases here, but this is one very interesting case that rarely do we come across. There's something called a compartment syndrome. We had this patient come in a couple days ago after he sustained an injury and was immediately sent to the hospital for attention. What is a compartment syndrome? In very, very basic terms, it's essentially, it's kind of like a pressure cooker, though there's a significant amount of swelling as a result of the injury. The pressure inside, in this case the foot, rises very, very quickly, just like a pressure cooker. The problem is that the pressure needs to essentially diffuse, decompress. It needs to go somewhere. If the pressure is not released, it will affect, in this case again, the foot, or it can affect the surrounding tissues to the point where tissue will begin to die very, very quickly. So we sent this patient over to the hospital, at which time surgery was taken to surgery, and they did what we call a decompression fasciotomy, and we were able to decompress the foot. In doing so, that was the first part of the procedure. Once we did that, then we let the foot start to essentially deflate. Once it deflates, then we took the patient once again to the operating room to cover the affected area. If you guys want to come around here, and I'll show you guys what we have here is this is one part of the defect that was very, very affected. And we were able to remove some of the necrotic, which means the tissue that was already dead in this area. And again, there was a lot of there was one compartment that was affected here, and obviously the dorsal incision. Another, we're able to reach other compartments in the foot. So what we see here, right here on the top, is essentially dermal replacement. With actually, if I'm not sure if you guys can see, there's a little shiny look to it, and that's a silicone. It's part of the dermal replacement. So what we're doing today is, again, believe it, even looking at the foot, that it's quite swollen. It's about, I would say, 70% less swollen today. So what we're going to do today is actually continue our efforts to heal the defects. We're trying everything in another tool in the toolbox, which we use a lot, as everyone knows, which is the platelet-rich plasma therapy. And PRP, as everyone knows, we've used it from anything from tendons to ligaments to injuries to fractures, and we've done some other cases in the past in respect to ulcerations, to again try to continue our efforts to heal the defects. This is an excellent case where we're going to go ahead. We've isolated quite a bit of plasma, and what I'm going to do is I'm going to inject the periphery, which is the surrounding area of the defect, because these defects usually tend to heal from either from the bottom up or from the outside in. And what we're essentially doing right now is we're prepping these two defects to eventually have a plastic surgeon, a good friend of ours, to come in and do a split thickness skin graft. So once and for all, cover these large defects. So, without further ado, what we basically do is just kind of inject the and we're going to continue to do so. put a stop here, and then we'll continue. Once we're done, we'll continue to record.
Doctor Wagner tiene muchos talentos. Muy bien, muy buena presentación. Sí.
Okay, so we have finished the procedure. Again, just to recap what we did, we injected the PRP all around throughout the periphery of the defect. We also went ahead and injected some of this area, which is what we call the wound bed. We went ahead and also did the exact same thing here. There are staples around the defect. These will eventually come off. Everything will eventually come off. Again, this is a biological dressing that will stay on for another a couple weeks, and then eventually that will prepare the area for the plastic surgeon to come in and do the split thickness skin graft or possibly something else. But again, this is it may seem very very striking at first. Yes, this is considered one of the medical emergencies in what we do, but I think everything's going to be fine. We're going to definitely save his leg without a problem. Dr. Hugo Fernandez, I'd like to give credit to Hugo Fernandez, who was the one that obviously he was the one that did the surgery, and we've been working again. He's one of our associates here, and we continue to always work as a team to saving limbs, saving lives. So I appreciate, again, like always, trying to present really interesting cases. I appreciate everyone watching. You can follow us at www.jawspodiatry.com. Have a great weekend.